The TMJ-TMD conundrum is real and has been puzzling the dental and medical professions for decades. This is the TMJ-TMD Demystified podcast with Dr. Tony Urbanic, where we'll connect the dots between TMD symptoms and the actual cause. We'll tackle common TMD misconceptions and educate you, the practitioner, about a simple, tested, and proven TMD solution that has already provided relief to thousands of patients, while helping practitioners build an additional source of income free from insurance control. Welcome to this episode of the TMJ-TMD Demystified podcast.
Hello to all you TMD warriors out there. We are here for the next episode of TMD Demystified, and I am Tony Urbanic. It's a Tuesday morning for me, my usual time to devote to making an episode of this podcast, and I look forward to doing this with you. Today's episode is the last in a series that I am making, gratefully so. Gratefully so, maybe to you more than me, on the topic of how come no one ever told me about this before. If this is the first episode you're listening to, hopefully it's not, but there are actually 10 prior episodes of the same topic, each describing a specific answer to that question. 10 different answers to the same question. And the question is voiced by our patients, actually here out of this practice, who say, how come they never told me about this device and protocol before? Because I've had this, and then what continues on, because I've had this problem for 20, 30 years, and no one else could solve it, and no one else told me that this was available, something like that. But the common denominator is, how come nobody ever told me about this before? And we hear that all the time, along with the parallel statement, the only thing I regret is not knowing about this, and then fill in the blank. 5 years ago, 10 years ago, 20 years ago, 30 years ago, 40 years ago. I've heard that many times. That isn't to brag. I'm not here to brag or be braggadocious. I'm here to inform, stimulate, educate, hopefully anyone who is willing and interested in listening to what I have to say and teach about this problem. And today, today's episode, again, the final one, because we already covered the subtopics of the responsibility to answer that question comes from insurance companies, teaching institutions, hospitals and corporate healthcare groups, venture capitalists, interesting so, the government itself, especially the feds, physicians and dentists as one category, rather than making it two categories. The patients certainly have a little responsibility. I view that to you. Pharmaceuticals for sure, myself, and I take a huge piece of that responsibility on myself, is how come nobody ever told me about this before. That is one of the reasons I do these episodes, and a whole lot of other work trying to get the awareness out there that there actually is a solution. Not that it has to be my solution, but there is a solution when you understand the problem. The problem itself is the problem itself is the problem, and not understanding what TMD is all about, where it originates from, the mechanics of it. The pathophysiology is the right term, the pathophysiology of TMD. And we're going to get into that just in a little bit. I'm going to give you an example, several examples of how it's totally misunderstood, totally misrepresented in the past. And now we have to overcome all that misrepresentation and all that false data and all that false information from multiple sources. my information is scientifically based. And I can show you, I can prove it. We have the study, but I want to compare and contrast that to what else is going on out there. So pharmaceuticals are doing a lot of things because they have the money to do it, but don't solve the problem. And as I said, myself, and then today we're going to cover a topic that I define as TMD, TMJ gurus. So let's first of all define what a guru is right out of the dictionary. Again, evidence-based. I don't know, right out of the dictionary, looked it up. Of course, a guru, first definition is an Indian teacher of Indian folklore and religion. Well, that's not the definition we're using. The second definition is a guru is an influential teacher or popular expert. Right out of the dictionary, a guru is an influential teacher or popular expert. That's the definition of guru. Now, my guru differs, my definition, this is my definition and why I specify. My definition of a TMJ guru is an influential teacher and expert who uses smoke and mirrors to treat TMJ, TMD. If you don't know what I mean by smoke and mirrors, I mean ethereal. That's a good word. Look up ethereal, and that's what I mean by smoke and mirrors. Ethereal, no substance to it. No substance to it. And those are what TMJ gurus do. They are influential teachers and experts in their own mind who use smoke and mirrors to treat TMJ, TMD with ethereal. Definition is good. My spelling is probably okay. Pronunciation is bad. Ethereal methods, no substance to them. So I also do a blog once a week, and this was the last blog I did on Sunday night, and which I'm going to go over virtually with you and record it on this podcast. So I have a few things to say about this further. The TMJ guru uses theories that don't address the actual cause, first of all. And again, this is what I have to teach. And if anything over the past 100, and this is the 130th episode that I'm recording today on December the 12th, 2023. If there's anything that would summarize in the most specific way anything that I've talked about, taught, discussed, draw your attention toward, made you aware of in the past. And that is, I discovered, or actually observed, I didn't discover it, I observed the root cause of TMD. I observed the root cause, and once I observed the root cause, then I investigated it to make sure that it had scientific basis, evidence-based, and then I went on to talk about it, teach it, describe it, make others aware of it, and then figured out how to address that root cause for the benefit of the patients, and to create a service that decreases the root cause and decreases all the symptoms, better known as this little device here, this thing here, which is easy to understand and easy to duplicate. Of course, it has a patent on it. You can't duplicate this one, but easy to use, easy to understand, easy to know how it works, and that's covered thoroughly on multiple other episodes. But today we're going to talk about the gurus because they are responsible, in part, along with me and a bunch of other people and organizations that answers this question, how come nobody ever told me about this? Because they have a part to play in that answer. So the gurus use theories that don't address the root cause, but they promote themselves well. They promote themselves well. What they do promote is, and this may not be a complete list, and it varies between gurus. It depends on what the guru wants to focus on, one or more of these three areas. But the gurus focus on the position of the temporomandibular joint meniscus or disc, and its position and health, and et cetera, et cetera. The muscles themselves, which is a large area that they focus on, the muscles of whatever. In this case, muscles of mastication, muscles of the neck, muscles of the upper torso, of the shoulders, and third, the mental state of the patient. So they focus on the position of the temporomandibular joint meniscus, the muscles themselves, which have a part to play, admittedly, a part to play in temporomandibular joint disorder symptoms, and the mental state of the patient, which inversely or by association has a part to play in temporomandibular joint disorder. I mentioned so many times, I mean, my colleagues would question me and cajole me, Tony, why do you want to do anything about TMJ? We know all the patients are crazy. I've heard that 100 times or more from my medical colleagues, primarily my medical colleagues who are more outspoken than my dental colleagues who leave all this stuff to themselves, but I have heard that from my dental colleagues also. So, but basically all three of those categories, and there may be other categories that I didn't come to mind, but they're the major three in my mind. They are symptoms. They are symptoms of TMD. The position of the disc is not the cause, it's a symptom. Whatever's going on with the muscles, however you want to describe it, whatever method you want to use to treat it, muscles, what's going on with the muscles is actually a symptom of TMD. And of course, the mental state that the patients get into, either before they develop symptoms, while they develop symptoms, or after they develop symptoms, their mental state is very obvious in many of these patients, and that is why multiple of my colleagues call them crazy. Well, they are not crazy, although there are a few that there are very few, very small number that, yeah, they get off the rails substantially, but the majority of the people that they refer to as crazy are not crazy. They're crazy with pain. They're crazy with frustration. They're angry crazy because no one can help them, and they expect doctors to be able to help them. And if you have a problem that you're living with for years and no one can not only help you, but they can't even explain it, and you're tossed aside as, and in some cases told crazy. I mean, the physicians sometimes tell the patients, that doesn't make any sense to me, you must be crazy. I don't know whether they refer them out for their craziness or not, but I've seen that. I've had patients tell me that. That is why I stick to this, and I am persistent on this awareness program that I am on, teaching program, to make colleagues aware of the real root cause of TMD so that we can actually solve the problem globally, not only in the United States, but globally. The second thing that the TMD gurus, again, what's the definition of guru? That a practitioner who uses asphyrial methods, smoke and mirrors, to treat TMD. And the other thing they have in common is they like to make it complicated. Now, why do they want to make it complicated? Well, they don't know any better. That's the reason. I honestly, I mean, I'm not trying to say that the TMD gurus, which I'm defining and describing, and I'm not going to go naming anyone, although I could, I'm naming categories and types. I'm not even going to, well, we'll just leave it at that. I'm not going to infer it toward any one in particular, but they do make it complicated. And I don't claim or say that they are trying to hurt anyone, but you can hurt someone by ignorance. I mean, if you are ignorant of a problem, but the problem persists, and you're responsible to help them, well, then you're hurting them by ignorance. But they want to make it complicated by increasing the time involved, by increasing the number of associates they get involved with the problem because it spreads the wealth. They justify the exorbitant fees sometimes, exorbitant fees in my mind. I mean, medicine costs a lot. Medical care costs a lot of money. But, we'll kind of define exorbitant fees here in a moment. But, charging exorbitant fees because they've extended the amount of time that they spend on it. I mean, I am aware in my own neighborhood here of a doctor who spends an entire morning. He's a TMJ guru, and he spends an entire morning with a patient doing a 3 to 4 hour consultation on TMD. It's like you can rule it out or rule it in 10 minutes. Seriously, you can rule it out or rule it in 10 minutes by a specific targeted history, viewing a simple x-ray just to back up, make sure you're not missing anything major, Panorex, and then a very, very simple exam. I mean, no more than a 3-minute exam on the face and oral cavity, which I've discussed and described and videotaped for you on other episodes. So they want to take a long time so they can justify the exorbitant fees, and then try to justify those exorbitant fees to medical insurance companies. That's the game. And that's the next thing I want to talk about. I mean, some of these gurus charge thousands and thousands. It isn't that I've heard of them. I've had patients tell me about them. The amount of money that had been charged, between $10,000 and $50,000, and then the time it takes to go through a treatment plan that can last anywhere between 6 months and 2 years of various kinds of treatment. And I'm speaking now specifically of dentist gurus, although there are things done by physical therapists, and we can spill that over into psychologists and psychiatrists. And then, of course, the pharmacopoeia that is used by physicians and the pharmacology of trying to treat these symptoms with drugs, when the simplicity of it is that all of the symptoms are driven by inflammation within the temporomandibular joint. Inflammation drives all the symptoms. So the gurus are off the rails, but they have to take responsibility for the patients who continually ask me, how come nobody ever told me about this before? Because they get into the arena or under the influence, whether it be direct or indirect, whether they saw a TMJ guru or whether they heard about a TMJ guru or a published TMJ guru or someone who has information in writing or on video or on the internet about the practices that are ethereal. That's pretty close to it. Smoke and mirrors. And number one, not effective, but number two, make the problem at times more complicated and actually doing dangerous things. Just a couple examples, like injecting steroids within the temporomandibular joint. I had a patient just yesterday had asked me, just yesterday, as it comes to mind, went to someone who claimed to know what to do about TMJ, and their solution was to inject steroids. And I'll let you go investigate for yourself the side effects and the bad effects of injecting steroids. And then of course, things like, and I've talked about this multiple times, the equivalence of Botox injections and the extreme amount of time and money that takes. I quoted the one patient I had. She said, I'll bring in the receipts for $200,000 worth of Botox over the past 10 years. That's $20,000 a year. For 10 years, that's $200,000. And she still had the symptoms, and either ran out of money or ran out of the time or ran out of the interest for Botox, which obviously could not help her. And she's sitting in my office with obvious TMD symptoms. So the TMD gurus are partially responsible to the patients who have found a solution and want to know, and in all honesty, they're not pointing fingers, they're not trying to criticize. They ask the question honestly, how come nobody ever told me about this? All right, so I'm trying to make that happen. I'm trying to change that. I want to use as an example, I'm going to use one example. I think we'll run out of time, and that's fine. Maybe you don't want to hear any more than one example, but all of these are recent in time. I don't have to investigate or prepare much for these episodes that I've been doing, because all the information is right on the tip of my tongue, right on my experience, right on my recent experience. And my most recent experience as of this morning was I opened up a email, and I monitor a site called the Facial Pain Association. Facial Pain Association, and they have a series of statements here, and I'm going to read this to you without deleting any names. But and this is an offshoot of the TMJ Association. TMJ Association brought to my attention the Facial Pain Association, who wrote an email, and it is described as Dr. Blank spoke to dental hygienists on November 9th, 2023. She discussed the role of dental hygiene in identifying oral facial pain conditions like trigeminal neuralgia, which is just a catch-all phrase. The physicians know it's a catch-all phrase, and the dentists don't know it's a catch-all phrase. How trigeminal neuralgia is defined is very vague at best. After her presentation, attendees asked several questions that we felt required the input of expert specialists. So we asked them, 3 members of the American Academy of Orofacial Pain, AAOP, 2 of whom are also members of the Facial Pain Association's Medical Advisory Board, offered their thoughts, and we took their input to create answers to the questions below. I'm only going to read 2 of 5, 6 questions here, but this exemplifies what I'm talking about is treating TMD with smoke and mirrors. So the first question that this esteemed group answered was, what causes a blood vessel to put increased pressure on the trigeminal nerve, causing trigeminal nerve pain? I'll let you look up I've talked on trigeminal neuralgia before. Trigeminal neuralgia is a catch-all phrase. The physicians definitely, if they have facial pain that they can't explain by it's a dental pain or abscess or something they can see wrong with the sinuses, they just call it trigeminal neuralgia. I don't know what it is. It's coming from the trigeminal nerve, and it's a neuralgia. It's neurogenic in some way. All right, the answer to this question is, and we're going to slow down here a minute, the current thinking is that with age, our connective tissue in blood vessels stretches, just like in the skin. The first 3 words on that. The current thinking. Well, thinking is not justifiable to come up with a solution. Not in this day and age. You have to have scientific evidence, evidence-based science now, evidence-based medicine, evidence-based dentistry. But right here, 12/12/23, this specialized group identified as the American Academy of Oral Facial Pain, and their representatives start out answering a question that really, it's the question itself doesn't have any evidence base to it, but answers it in a way that there's no evidence to verify what was just said. And the blood vessel is able to put more pressure on the nerve based on gravity and normal position. In addition, over time, the contact between the blood vessel and the nerve causes the protective myelin sheath to wear down. That is just that's theory. That is just, could that happen? Probably not. Maybe so, but you definitely, it's like they're just throwing stuff at the wall that sounds good, that would definitely snow a patient. Oh, you can say myelin sheath, and that has to do with nerves, and that must be important. Well, unless you know a little histology, anatomy, cell biology, and you can obviously see that has no basis in reality. To wear down, offering additional exposure of the nerve itself. There's no evidence that exposure in any way, shape, or form, or association with any muscle or muscle sheath in any way, shape, or form generates trigeminal neuralgia, which has no really strong specific definition. It's a catch-all phrase. That is the state of the art. Here's state of the art. December 12th, 2023. All right, so let's just do one more. Why does this condition, this is the second question that they're answering here, based on specialist gurus. In my opinion, I'll take it. That's my opinion. I can have one. The American Academy of Oral Facial Pain answers this question: a combination of factors may be relevant, may be relevant. As referenced in the previous question, they're already referencing the previous question that says the current thinking, the stretching or sagging of the connective tissue in blood vessels over time means this condition would more likely occur later in life. Well, we all know that things fall. My wife and I were just talking about this yesterday. As we get older, things on our body fall. This is a true statement. You don't have to be a scientist to see that. You see it on everyone. There are no exceptions. It happens to you. It happens to your wife. It happens to the neighbor, and you see it. So that is a fact. You don't have to have scientific basis on. But whether it addresses trigeminal neuralgia or facial pain is a different question. The stretching or sagging of connective tissue and blood vessels over time means the condition would be more likely later in life. There's no science in that. Multiple traumas to the nerve that take place over time, and examples of this as root canals and extractions. There's no evidence that an extraction or a root canal is going to cause more trauma to the trigeminal nerve. I mean, you're going to sever the nerve to a tooth when you take it out, or remove the nerve when you do a root canal, but that does not mean the trigeminal nerve root itself, or any part of the trigeminal nerve beyond the tooth itself, has any kind of damage to it. But that's what it says here, right there. Can also cause insult, and by the fifth decade, the threshold may be reached to trigger spontaneous firing of the trigeminal pain. Also, nerve irritation over time causes nerves to change the way they function. No evidence on that. In some cases, they function faster, leading to sharp electric pain. The speed of a nerve itself does not elicit the type of pain that is elicited. That's basic physiology. I'm sure you remember when you took your basic physiology course. Yes, the speed varies between different nerves and the same nerve at different times, but the speed of the nerve does not actually generate the type or the sensation of the type of pain. Finally, the efficiency of the immune system and its ability to launch a protective attack decreases with age. Well, that's generally speaking true, although we know very little about it and why that would be the case, because we do not understand the immune system even close to the amount that we need to understand the immune system. So generally speaking, here's 2 paragraphs and 2 questions being answered by TMD gurus, my definition, that don't hold any water at all in 2023. And because the general dental industry, that is dentists in practice, don't want anything to do with TMD, there has been a void formed, and the void has been filled to a large part by dental gurus. Let me repeat that, because that's actually the touch point, the basis of why I did this episode. And that is obvious to you all listening. You all know that 50% of dentists don't want anything to do, cover their ears, don't want anything to do with TMD. If you say TMD, the patient says TMD, you talk to the doctor about TMD, they close their ears, they close their mind, and don't want anything to do with it because they know nothing works. It's very complicated. You were told it was very complicated in dental school, and they've seen the results of how complicated it is because everyone wants to make it complicated. So 50% don't want anything to do with it, and 50%, well, not quite accurate, 49.9% of the doctors, of the dentists, make a night guard, because why do they make a night guard? Because that's what everyone else has done for the past 60 years. Make a night guard, give it to the patient, say, here's your TMJ treatment. And what they don't tell the patient, but they think, is, I hope you don't come back because I don't have anything other than a night guard to give you. And a night guard is a night guard. It protects the teeth, but it has nothing to do with treating TMD. And then you have the 0.1%. Remember, 50% don't want anything to do with it. 49.9% use a night guard. And then that 0.1% represent the TMD gurus. That summarizes it. That's my point. I'm very emphatic about it. I'm very emphatic about it because I'm the one who has to face the patients, who asks the question, and it's an honest question from the patient. They would like to know an answer. I've thought many times at the time of those questions, should I sit down and go through the litany of why they didn't hear about it, why they don't know about it? And to a large part, it's intentional that they don't hear about it. I'm not saying that anyone out there is trying to intentionally hurt people, but they're intentionally trying to do things out of ignorance, throw things at the wall to see whether they stick or not, avoid any kind of scientific study on the issue, and they use phrases like the current thinking, combination of factors that may be relevant. All right, well, I made the point, and fortunately, this is the last in the episode. I'm not sure the track I'm going to take on the next episode, but it's not going to be this one anymore. If you're interested in reading the entire series or listening to the entire series, you can go back and begin 10 episodes prior. I do pay attention to the number of people that look at these episodes, and some of them are more viewed than others. But some of them have significant viewing to them, and I encourage that. my point always has been to think critically on what you hear and read. Critical thinking. I learned that along the way, especially in my residency in oral and maxillofacial surgery, to address whatever you read or whatever you hear with a concept of critical thinking. In other words, does it make sense to you? Did you investigate the basics on it? And now we have, scientifically based studies, which converts into statistics. And then you have some comments you can make about statistics. Statistics themselves can be swayed. So, there's no perfection here we're looking for, but we're trying to get away. I am trying to get away from treating TMD and allowing TMD to be treated with things that are basically ethereal, smoke and mirrors, by TMD gurus. With that being said, if you would like to criticize me, if you are a TMD guru which would like to take me to task, you are welcome to contact me, encouraged to contact me at tony@tmjservices.net. Our director of education and marketing, who is available to send information, to speak with you, Dr. Naomi will be able to send you whatever you need. Send you our study. If you'd like to read it, have it. We'll send you whatever information you want. Her address is naomi@tmjservices.net. Our website is a plethora of information that is available. That is www.urbanictmj.com. And if you would like to join the growing network of doctors throughout the United States and beyond who use a very simple device which does address the root cause and allows the root cause to diminish, meaning inflammation within the joint to diminish, go away, after which the symptoms then diminish and go away, you're welcome to join the network. You can do that off the website, www.urbanictmj.com, or call us directly. We can get you on the course you need to take, 3-hour course with 3 hours CDE, CME along with it. And you can use the device in your own practice to the results that we have here in Middle Tennessee, which is very, very high, depending on how you define results, between 85 and 95% success rate, depending on exactly how you define success. But those are good numbers. So for today, I'm Tony Urbaniak. This is TMD Demystified. I look forward to our next episode.